Hi, my name is Pamela Nyman, and I will be demonstrating the administration of a piggyback medication. I will begin by verifying my physician's order for the medication. The physician has ordered vancomycin, which is an antibiotic. He's ordered it at 500 milligrams every 8 hours. So I'm going to check the chart for any allergies to vancomycin, which the patient does not have any. And the dose is appropriate for that medication. And so I've got my little medication card here. I'm going to use normal saline for the piggyback, and Vanco is compatible with normal saline. And it will infuse over 1 hour, and we will monitor, because the medication is ototoxic and nephrotoxic, that it does not infuse too quickly, and it will definitely not be given through an IV push to prevent that. Other side effects to monitor for would also be hypotension, red man syndrome, diarrhea, nausea. So during the duration of therapy, the patient will be monitored for these side effects. It will go in a 100 milliliter bag of normal saline. So at this point in time, I will prepare my medication. I will perform hand hygiene, and this is going to be vancomycin, 500 milligrams per ml, and the dose is 500 milligrams every 8 hours, so we'll withdraw 1 milliliter of the medication, and the medication bottle is within date range. And I would alcohol a bottle, draw out 1 milliliter, bag. This is a 50 milliliter bag, but we are going to imagine that it is 100 milliliters of normal saline. And I would take an alcohol, the port, insert the needle in a very straight angle, so not to puncture the bag, insert the medication. This would go in the sharps container, rotate to mix it, and at this point I would apply my medication label, which would include the name of the medication, the dosage, the patient's name, my initials, the date, and the time of administration. And I would also label my tubing with my initials, the date, and the time, so the tubing can be used again through the duration of the 24 hours. So I will now attach my tubing to the medication using sterile technique. And this has been used before. At this point, I would remove the sheath that is over that, and I would insert. I would make sure my tubing is clamped completely before turning it over. I would fill the drip chamber to about 1/3 full, and I would prime the line, which I don't think it'll work because I've used, oh it is. So I would prime the line, it's already primed, until the whole tube was filled with the medication. And at this point I would gather my supplies. I would get my gloves, I would get this nice little hanky thingy, I will get plenty of alcohol and an alligator clamp for the tubing. I would gather my medication, my MAR, and the bag. Oh, actually, before I did all that, I would calculate my drip rate, which I had done previously. It's going to be in a 100 milliliter bag over 60 minutes of infusion time with a rate of 10 drops per minute per my bag setting, or my tubing setting, which gives me 17 drops per minute. So I have that pre-calculated. So now I will take my stuff into the patient's room. Knock, knock, knock. As I enter the room, I would perform hand hygiene prior to talking with the client. Hello, Mrs. Smith. My name is Pamela Nyman. I'll be your nurse today. The physician has ordered that you receive vancomycin, which is an antibiotic. Have you ever had Vanco before? You have not. Okay. It's a very strong medication, and I noticed that in the chart there were no allergies, so I just want to verbalize with you again that you have not been told you have an allergy to Vanco, and you have not. The medication is a little harsh in your veins, so we're going to make sure we monitor it and infuse it slowly so that we can prevent any nasty side effects from that. Your IV site looks good. Have you had any pain or swelling? I don't notice any swelling, but any pain in the site? There's no redness, no heat. It's not cool to the touch or anything. Very good. And before actually administering the medication, I would again verify the patient's name and date of birth. Can you tell me your name and date of birth, Mrs. Smith? Thank you very much. So everything looks good, and we are going to prepare to hang the medication. All right. And I have performed hand hygiene, but I'm going to hang that bag, and before we get started, I will apply my gloves before we touch the site. And what is hanging is normal saline currently through her IV, so Vanco is compatible with normal saline, so there should be no problem. No new line needs to be started. Very good, and I've already assessed the site. So what I will do is I'm going to clamp off her primary line, and I'm going to take and lower the primary lower than my piggyback. There we go. And I'm going to hang my piggyback higher than the primary. I've clamped off the tubing, and I will access the port below the actual clamp. So I found my port, I'm going to clean it. Here's the clamp, it's below the clamp. And then I'm going to attach my alligator clamp to my tubing, my piggyback tubing. Clean that port again. Let it dry and attach the tubing, and it was running, so the extension tubing is already unclamped. I would then adjust the drip rate I would watch for a minute and adjust the drip rate to the previously calculated 17 drops per minute. Once that was reached, I would maintain that state. I would come back within 15 minutes and monitor the patient for tolerance. Would again assess the IV site, make sure there's no pain, redness, swelling, coolness to touch, anything going on there. She would complete the duration of her therapy. At that point in time, when the IV was completed, I would at that point disconnect the piggyback line, which I'm doing now, and then I wouldn't have to flush because she already had normal saline running. And I would reintroduce the previous rate that the normal saline was running prior to me turning it off. And I would again assess patient tolerance, assess the IV site, perform patient teaching that if she experiences any adverse reactions or side effects to let me know, and also educate her on calling for assistance to get out of bed, so not to dislodge the IV, and again call me if anything abnormal occurs. And that is the end of my demonstration.